Okay, chapter 7 and 8 are really covered in lab, but I did want to pull out a couple things that I think are important in these chapters as far as lecture material goes. And that is when you think about that axial skeleton, right? I know you were learning the cervical, thoracic, and lumbar vertebrae. But what I want to focus on here are what they're calling the spinal curvatures, right? And they're named after which of those regions that they're found in. Now, so notice what happens here is the cervical curvature is kind of this way, thoracic goes this way, lumbar goes this way, sacral goes that way. Two of these curvatures are called primary curvatures because you're born with them. So think about like a little baby curled up and which way those curvatures go. The thoracic curvature and that sacral curvature are what we call primary curvatures. You're born that way, right? Already kind of curled up. But it's the lumbar curve and that cervical curve, like to hold your head up and to hold your body up, that are secondary curvatures, and those are going to develop later in life. Okay? So again, thoracic and sacral are primary curvatures. Cervical and lumbar are developed secondarily as you start to hold the body upright. Sometimes these curvatures don't work properly, so I wanted to point out, we saw this kind of in that older woman with the osteoporosis, but we also can see that just as a deformity of the spinal curvature in something called kyphosis, almost like a hump back. Lordosis refers to an abnormally exaggerated lumbar curvature. Now that would be temporary in something like pregnancy, but over the long term, we would be concerned about the stresses placed on the body there. And then a lot of us are familiar with this idea of scoliosis, which is an abnormal lateral curvature of the spinal cord, something else that should be seen by a doctor, taken care of, because this is a pretty severe looking form here. You can kind of see how the muscles and other parts of the body are starting to become deformed as well, and over the long term, this can be really problematic for an individual. Okay, that's it.